Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Alcohol use disorder. Introduction. Alcohol use disorder is when a person craves alcohol, needs it to feel good, and is unable to stop drinking once they start. The person's drinking causes harm to themselves or others. This program explains alcohol use disorder, the health risks associated with it, and how to overcome it. Alcohol use disorder. Alcohol changes the balance of certain chemicals in the brain and makes the user feel happy. It also makes the user more impulsive. The effects of alcohol go away after a short while, and the person craves more alcohol to feel good again. This makes the person keep drinking to continue feeling happy. It can become an addiction. There are several factors that can lead to a person becoming addicted to alcohol. A major factor is genetics. A person with a family history of alcohol use disorder has a much higher risk of developing it. High levels of stress, emotional pain, or anxiety can lead to drinking in the hope that it might stop the feelings of pain and confusion. When a person has depression problems, it can also lead to excessive drinking. Unfortunately, society often makes heavy drinking look glamorous, which gives a message that heavy drinking is cool. The health risks. Alcohol can cause a lot of health problems. Heavy drinking causes liver problems, including hepatitis and cirrhosis, which is irreversible damage to the liver. It also can damage the pancreas and the lining of the stomach. Excessive alcohol use can lead to heart failure, stroke, high blood pressure, and cardiomyopathy, which is damage to the heart muscle. Excessive alcohol can cause permanent short-term memory loss, weakness of the eye muscles, bone loss causing broken bones, erectile dysfunction, menstrual problems, numbness in the hands and feet, and an increased risk of certain types of cancer. If a pregnant woman drinks, it can cause the baby to have a small head, eyelids that are too short, heart defects, and developmental disabilities.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Overcoming alcohol use disorder. When a person is dependent on alcohol, just cutting back on how much they drink will not work. Abstinence, or stopping drinking altogether, has to be a goal of treatment. It often takes a family member, coworker, or friend to convince the person to get treatment for their disease. Denial is common. People with alcohol use disorder often deny they have a problem. A very common form of treatment is regularly participating in a support group. One of the most widely known support groups is Alcoholics Anonymous, or AA. Support groups encourage people to get and stay sober and to maintain healthy living habits. Another form of treatment is making regular visits to a healthcare professional who treats alcohol use disorder. Examples of such professionals are psychologists, psychiatrists, or specialized internal medicine doctors. Some people require inpatient care at a healthcare facility. They can live there temporarily as they go through detoxification, therapy, drug treatment, and counseling. Treating alcohol use disorder is harder than preventing it. People with a family history of alcohol use disorder may decide it's best to avoid alcohol entirely.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Alcohol use disorder is a disease that can run in families. Long-term treatment, counseling, and belonging to support groups may be needed to treat it. Alcohol use disorder can cause a lot of serious health problems. Some of these can be permanent and deadly, such as cirrhosis. When a person is dependent on alcohol, just cutting back on how much they drink will not work. Abstinence, or stopping drinking altogether, has to be a goal of treatment. With treatment and a commitment to stop, recovery is possible. Treating alcohol use disorder is harder than preventing it. People with a family history of alcohol use disorder may decide it's best to avoid alcohol entirely.
Thank you for using Explain.